Welcome, everyone, to another episode of the Nurses Station. We are so glad to have Dr. Robert G. Hess here with us this evening. As you can tell, we're a little early this today because we really wanted to get Dr. Hess here because he has such a great he has such great knowledge on this topic, and it's a hot topic. Gender salary gap in the nursing profession is just as real as other professions. So we're so glad to have you here, Dr. Hess.
Glad to be here.
All right, a little bit of background, so all of you know, is Dr. Hess, PhD RN, and part of the academy as well. The American Academy of Nursing is the OnCourse Learning's Executive Vice President and Chief Clinical Executive. He is also the founder and CEO for the Forum for Shared Governance. And as a blogger for nurse.com, he's penned editorials on career topics across the board in the nursing profession. And he's also a presenter at professional conferences and often addresses participants on how to find the right jobs and the steps for building a successful career. So on that note, one of the research that you've been invested in and participating in, Dr. Hess, has been on this gender salary cap. Or gap, not cap. I don't know how many people had a chance to read the article that we put a link when we promoted this episode. But before I get into my questions, what was just kind of the overview of how this came about in research and wanting to create this report for the profession?
Well, everybody and their mother does a salary survey in nursing. But I really think, I contend that nurse.com has really got the biggest dog in this hunt, because we've been around for a long time, from the nursing spectrum iteration. And we've always been about, we originally were about nurse recruitment and careers. In fact, 26 years ago, I started with this company as Philadelphia's nursing spectrum editor. So I've been a nurse for 40 years, and I've been with this company. I'm the last man standing with a nursing license or with any sort of license for a long time. And I've been tracking issues, and some of the issues change and some of them haven't. As far as our demographics and who we are and what we're doing and where we're represented in the United States as far as nursing shortages, because that's where we made our money. I mean, through recruitment originally, we're always dead on that. So for us to do a salary survey, a new iteration at the end of 2017, it was not a leap. I mean, it's just a natural fit for us. And I was lucky enough to be a part with Jennifer Mensick was with us at the time, Dr. Mensick. So the two of us are research PhDs in our own areas. My area is shared governance in particular, but we had a crack editorial staff, Heather Seigan, Sally Jimenez. We had Eileen Williamson, she's a nurse leader. We all got together and we were able to craft the questions in this survey. And one of some of the questions revolved around money, because, whether it's good or bad, money is a huge hot button in nursing all the time. And who makes it, and who's making more, and who isn't making more. People really want to know about that. In fact, when I I became a career blogger. Again, my role changed about a year and a half ago, 2 years ago, and I wrote an editorial on salaries. And I had the audacity to say that some nurses were making six figures, which earned me a salvo. What planet do you live on? And I don't know anyone that makes six figures. Well, maybe you don't know anyone that makes six figures because you're at a critical access hospital in Montana. But if you're in New York City and you're in San Francisco, you know a lot of nurses. And we're not talking about managers either. That's the other thing. You must be talking about a manager, and you have too many initials behind your name, which means that you have no idea what you're talking about. A lot of people came to my aid and said that they were making six figures, and some of them not with overtime. And money's always a hot issue. And So 2 years ago on Facebook, somebody wrote about the gap between the genders in salaries. And, Dr. Stupid here, I wrote, that's nonsense. That was taken care of years ago. Well, and it's an old data. So that nurse took me to school immediately because it was current data. And so we were sure to get questions like this into our salary survey. And I'm glad we did, because we have substantiated that there's still a significant gender gap in salaries in nursing. And in 2020, it's just 2018, it shouldn't be there. It just shouldn't be there. And I think that we're coming onto a time where we're going to be able to rectify that, or at least have players in the nursing profession that are going to be able to remedy that. That's good news.
Absolutely. And, we talk about, again, there's old data, and by doing this new research, it showed that it's still there with new data. And, this is not just specific to the nursing profession. This is across the board. We still have this gap between men and women in the salaries that they're having. But I think we have, and correct me if I'm wrong, but I think we may have different, or unique is more probably the appropriate word in regard to why that is, because our profession is not, I would say, what you would see as or the standard makeup of a profession. I mean, 90% of our workforce is women, and men still. I mean, you can go back. You talk about data and inconsistency of who says what. I mean, we range anywhere from 8 to 13% male nurses within our profession, depending on who you want to talk to, and on the research. But
I'll tell you what it is. It's a literary device. It's irony.
It's
ironic. It's ironic that there should be like maybe 12% men, and they're making more than 88% of their colleagues. It's just ironic, and it's very weird.
Yeah. Well, and they talk about, this article that in the New Jersey Real-Time News, they talk about some of the reasons that when they interviewed individuals that, they said, and I don't know how true this is. I'm the middleman here for all of our listeners, but, men tend to negotiate their salaries more than women, just historically, and they are in administration and entrepreneurship more compared to women. But what's your personal take on why that gap may still be there?
Well, here, first of all, let me tell you that the average for men salary national, and this was controlling for the total hours worked, years of experience as a nurse, looking at ages, educational level, and certification status, was $79,688 for men and $73,090 for women. And that's a gap of around $6,000. I don't quite have a handle on the regional gaps. And I think that that's something, now that we said we were going to do this little interview or discussion, that I'm going to go back and look at this week. But this went out in our press release on June 19th. And so, that's a significant salary issue. And I think when I thought about this, that there's things that men do and things that women do that help perpetuate this gap. We found that 43% of men said that they negotiate when they negotiate salaries when they go in to start a job or interview for a job or a promotion. Actually, I'm not sure whether that was phrased just for promotions or job changes, but there was 43% of men said they negotiate most of the time or always, as opposed to 34% for women. We didn't ask if the negotiations are successful or what success might mean. We just asked that question. And that's significant, I think.
Yeah.
So that's something that men and women do. Men do this, and men and women don't, and so that's contributes to this. Also, breaks in career, that comes up a lot. We couldn't control for breaks in career, and what I mean by that is that we believe that men tend to start a career and they work it until they retire in some sort of a linear fashion, while women sometimes stop and start their career for things like having children. It's not as popular here as it is in Europe for men to take time off for work, for child rearing. They just don't seem to do that, although maybe that will happen one day. There's another aspect to breaks in career, though. So I speak at NSNA every year, the student nurses. I've done it 15 years in a row now. And I talk about interviewing organizations that are interviewing you. And, I'm on the board of the foundation, and I represent nurse.com on that foundation board. And I talk about career fitness. And one of the things that I talk about is the nursing short-term and long-term economy. And one of the things that I mean by that is what the unemployment rate is, state by state. And because I think 70% of nurses are married or have a significant other, nurses, female nurses that are married, tend to, I believe, speak of their career, of their incomes as secondary income. Now, I've been married to a physician for 41 years, and she's not most of the time made more money than me, but I really didn't look at we didn't look at any of the incomes as a secondary income because we both worked all the time. Now, somehow she managed to retire before me, so she's a very smart woman. But when the unemployment rate goes up and the primary breadwinner loses their job, then the secondary income person kicks in and works full time or ups their hours. And it seems that when the unemployment goes down and the men or the primary breadwinners are back to work, the secondary income is not as important anymore because it's secondary. And I think that fosters less hours or breaks in career that might lend itself to less salary. See what I'm saying? So that's a break in career too. So there are many reasons that break a career, but that's something that people think because you don't have a linear career where you're making more money from year to year. Your salary might jump up and down.
Gotcha. And Carlo, I wanted because there's some individuals asking some great questions. I think this kind of pertains to this break in time because he had originally asked, do these numbers or did the research look at family obligations, childcare, and I think we answered that question, which that's great how you're anticipating the questions that people are asking. But he also then asked, did this research look at specific specialties? Did it drill down on that aspect, or was it just a blanket overall professional 30,000 foot view of all nurses and kind of how they react to the survey?
Well, because the way we designed the survey and tried not to have forced answers and tried to keep the numbers pure so we could manipulate them to do tests with. In other words, we didn't ask people if have you worked 5 to 10 years as a nurse, 11 to 15, 16 to 20. We actual numbers so we could play with them forever. This is the gift that keeps on giving for a career blogger like me, because every time I look at a different specialty, I go back to the SPSS database and play with it and look at different things. So I think that we did look at, if this is what you're thinking, we did look at specialties and what men and women made within those specialties, because it sticks in my mind that for some odd reason, chief nurses, men actually made less in this sample if they were a chief nurse than women. I'm going to have to go back and check that, but Carlos, is that what you mean? I do, and I think that the nurse anesthetists, that there was a significant gap between men and women in that specialty, and that's kind of weird to me, because that's always the example of so where do men go to make a lot of money? Well, they become managers, or they go and they become a nurse anesthetist, because those people make six figures easy.
Yeah.
But here I think that men made more money within that specialty, and in chief nurses they made less.
Yeah. So, we talk about specialty. We talk about just the overall difference between male and female. But I was also curious when it kind of spoke a little bit in this article about that the gap has decreased a little bit in that age range between 24 and 35. And then I was looking at so that intrigued me to go try to find statistics of what makes up the nursing profession right now. And I did find the minority nurse that, average mean population for LPNs is around 43.6. RNs is, very close at 44.6. But RNs under 30, which kind of makes up most of that age range that is stated in the article, is only, LPN is 18.6 and RN is 14.8. So I guess my question that stems from that is, because of those traditional thoughts of, secondary incomes and what that means to individuals based off maybe the generation that they grew up in, and compared to the generation that's coming into the nursing workforce now, does that have any impact, or was there any correlation, or do you think that there could be potential of researching that there may be a trend to look into, and what that may be, and how we think as in our own generations of approaching our profession?
Well, get ready for the avalanche, because things are about to change as far as generational groups as we know it. This is not particularly my research area, but I was lucky enough to be in Princeton a couple months ago at an event talking about mandatory staffing and shared governance. And you want another hot button, that's a hot button. But Peter Bearhouse was there, and I've known Pete for a very long time. Dr. Peter Bearhouse, he was with Vanderbilt, Nashville for quite a while, but he's in Montana now, being a professor and a cowboy, so you can have your dreams. So he said something that surprised me. We know that the baby boomers are retiring, if people like Bob Hess would ever get out and start to retire. But we wondered about the nursing shortage and the catastrophic nursing shortage, which is probably not going to happen. We're just going to have little regional shortages, because we've been doing such a good job of recruiting and educating nurses regionally. And it turns out that in 2020, this will be the time that the millennials replace the baby boomers as the largest group in nursing.
Wow.
I thought that was like way far away, but it's not way far away. It's around the corner. So I had my niece and nephew over. I live in a resort during the winter or during the summer, and they were a shore resort, so they were down for the weekend. And I said to Melissa Block, she's a teacher at the Philadelphia School, and she's a millennial, and we were talking about this, and she's pretty big advocate for women. And I said, so if millennials take over, what is the news there for gender gaps in wages? I mean, will it make any difference? Do you guys got a different dog in this hunt? What will happen? And she said, well, one of the things that's different about my group, the millennials, is that we're connected. We've been connected all our lives, and we and so information is not filtered. First of all, they don't buy the information that my group has bought and perpetuated on the market. And, they don't wait for the newspaper to come out to get information. And so when this is an issue, they're right on top of it right away. And they don't expect things to not change. So she feels as though that group is sensitized to this and will be on it. And,
yeah, as a millennial myself, I can complete that. That was so well stated in regards to, because it's not because we care about it more. I don't believe that. Where I'm at is that it's just we have been connected. We stream information in such a quick time, and we've always been a part of that. And it's not because other generations don't utilize the same platforms that we use today to get our information. It's just this is all we've ever known. And it really impacts on how we approach issues. And I completely agree with her that we all hope that we can finally get there. And it is our responsibility as millennials to take up the torch and to keep moving it and not making it a moot point.
See, here's the other thing that I just love talking about. So I am the webmaster for sharedgovernance.org. So I'm able to change things on that website, and I'm like at a drop of a hat, and I follow things, and I do probably more research comes through me in shared governance than any person in the world. So I've got a lot of data that I look at that no one else sees. And so when a hospital uses my instruments to measure shared governance, trending all the time practically, the group that thinks that they have the most say and that they have the most influence in governing professional governance is the millennials. And that to me is just incredibly good news. And, I tell baby boomers and dinosaur people, that things are going to look up. I mean, the torch, like you said, is going to be carried very well to the finish line by the millennials. And that makes me feel good.
Well, I greatly appreciate those kind words and the trust in us in the next generation, because we're raring to go. And I know a lot of us like myself, are already here, but we're really galvanizing and trying to push out to our colleagues to get on board and start, because advocating for your career and the more of us that do so, the better our profession is going to be off. But I wanted to, before we close here, because we always do shameless plugs on this show for our guests, and I want you to have that time. So with OnCourse Learning and nurse.com and the blog, can you talk about a little bit of what that platform is, and then anything that's coming down the pipe that we in the organization should be really paying attention to and would find interesting?
Yeah, so we're the largest CE provider in the world. We gave out 4 million contact hours just to nurses last year. We do 24 professions, and 25% of our output is interprofessional. So we're not just looking at nurses, we're looking at everybody. So I should hope that you keep your eye on us and the things that we do. We have over 4,000 educational activities out there. And, we have so many that I can't keep track of all of them anymore, but you can bet that we're going to have some activities around how to negotiate. I think that would be good. I'm going to write a blog on it. I'm going to write a blog on how to make more money in nursing outside of entrepreneurship, but within your job. I mean, how to ask for money, how to look at relocating. I have one coming out shortly on how to change your specialty. And in the middle of that, I write, it's okay to change your specialty if you're tired of the old one to one that makes more money. It doesn't mean you're a bad nurse. That means that you can be a good nurse and be a good rich nurse at the same time. There's a lot of us that have been making good money for many years, and we didn't think it diminished us as a nurse. So they're not mutually exclusive. So I hope that you follow us at nurse.com. We're probably going to do another salary. I know we're going to do another salary survey because this one worked out so well. And like I said, it's the gift that keeps on giving, because there's so many aspects to this that every time we turn around, there's something else that we need to look at. And we'll get better at this, I think, each time we do this. As far as my shameless plug outside of OnCourse Learning Healthcare, nurse.com, which, by the way, is what used to be Nursing Spectrum or Nurse Week. So people know that they didn't go away. They just became something different. I have a website, careerwhisperer.org, and the Forum for Shared Governance, which is crediting hospitals in shared governance now. We're writing competencies now in shared governance. And I am trying to get to 4,999 Facebook friends, and I'm up to 2,020 right now. And I appreciate if anybody could to friend me at Robert G Hess Jr. and help me reach my goal. I already reached my Pokemon Go goal, and I'm level 40 now, so I'm fulfilled there. But I've got many other goals.
Yeah, so you are. Many people don't know that you are a Pokemon Go Jedi Master.
Yeah, just a crazy person. My wife and I are Pokemon Go people. At any rate, my Twitter handle is Dr. Bob RN, and I'm on LinkedIn, and I'm on Instagram. I'm on whatever. And never feel shy about getting hold of me or Hess at OnCourseLearning.com. And I'm the easiest person in the world to get a hold of. This is my job. This is my job, is to advise nurses or be here to interact with nurses, and to connect between my company and nurses. I like what I do. So, easy to get a hold of Bob.
Absolutely. And I will tell you, I'm already there, Dr. Hess. I'm a friend, and I would greatly encourage all of you to do so as well. He's just an amazing resource to have at your disposal. Thank you again for coming and speaking on this topic. I know that we could continue. This could be a series of shows on talking, because the data is the gift that keeps on giving. So I hope, as this continues to evolve, that you'd be willing to come back on and give us an update of where this is going, because I think the more we can get this out here and people understanding what the data says, kind of gets through the preconceived notions of what that first data point of that gap number really means and what we can do to change it. So,
and as men in nursing, I think we have an obligation to help.
Absolutely. And that's why AAMN is so passionate and takes such a great stance on this, and will continue to do so, especially as more reports come out, because we ask our female colleagues to take us in regards to being, great contributors to the profession. And this is a way that we need to, and we all feel is very important, that we help as well from being men in the profession, of what we can do to help our female colleagues who do the same wonderful, amazing things that we do to have equal pay. So have a great week, everyone. Next week, we are taking the week off. Enjoy your Labor Day, and we'll get back at it. And if you haven't signed up to come down to the conference again this year, it's going to be Millennial Ran. We're having live podcasts during the conference with our speakers and students and faculty, and it's going to be a great time. Dr. Hess doesn't know this, but it's going to be set up like Sports Center, so it's going to be really cool. It's never been done. He's been to a few AAMN conferences, so he could tell you historically of what the conferences are, but this is going to be brand new. So I'm really, really excited. So thank you again, and we will see you in a couple weeks.
Thank you.